Obsessive compulsive disorder, or OCD, affects 1 in 28 Singaporeans. Traditional treatment takes months of medication and therapy. We changed that into just 4 consecutive days.
Our team adopted the Bergen 4-day treatment from Norway, which condenses therapy for OCD into just 4 days straight. The results? Over 60% of patients showed significant improvements with less than 2% dropping out.
This proves that concentrated, focused care is both efficient and effective, delivering hope faster to those who need it the most.
The Bergen 4-day treatment is now a standard OCD treatment at the Institute of Mental Health. Outside the Institute of Mental Health, we also plan to train therapists in the restructured hospitals and community to run this treatment.
Our message to fellow healthcare professionals: stay curious, collaborate boldly, and never stop seeking better ways to serve our patients.
Sometimes, the biggest breakthroughs come from rethinking everything we thought we knew about treatment.
Many seniors, particularly those who are frail or pre-frail, face barriers to exercise due to medical or social challenges. Exercise is essential for their well-being and chronic disease management. At St. Luke's Community Clinic, we launched Exercise is Health, EIH, an individualized, multi-pronged program. It combines rehabilitative equipment and gamified functional training to make exercise safer, more accessible, and integrated into daily care. Between May 2023 and December 2024, we conducted over 9,000 sessions for nearly 450 clients, totaling more than 500,000 minutes of physical activity. Patients demonstrated measurable improvements in physical, metabolic, and psychosocial health. Exercise is Health also fostered a community where clients exercise, connect, and support one another. For patients, exercise became empowering, improving chronic disease control, mobility, and mood. Staff shifted their perspective, viewing exercise as a vital sign and a key component of preventive care. Our next steps are to scale Exercise is Health across more clinics and hospitals, adapting it for different patient populations. Our vision is for exercise to become a norm in every care setting across Singapore, with external referral interest already emerging. The foundation of this program is patient motivation and readiness. Sustainable impact happens when community, environment, and social norms all support healthier choices.
Healthcare providers often face uncertainty in deciding when antibiotics are needed for lower respiratory tract infections such as pneumonia, bronchitis, or chest infections. Overprescription increases antimicrobial resistance and workload. AI2D is a digital solution that identifies when antibiotics are not required. It analyzes patient data and delivers personalized recommendations in real time, helping clinicians make confident decisions at the bedside. Unlike generic clinical guidelines, AI2D provides patient-specific guidance that mimics infectious disease specialists, enabling expert-level decision-making for all healthcare providers.
AI2D delivers the significant efficiency and cost benefits. It reduces typical process time from 170 hours to 30 hours, and it cuts daily caseloads by 66%, and it achieves cost savings of more than $3,000 per patient. It also improves antibiotic stewardship with 31% early antibiotic discontinuation versus 7.8% in standard care, exceeding expected improvements. The system is designed for seamless integration with any electronic health record system, regardless of format or interface. Hosted on the National Cloud Platform, AI2D will be accessible across healthcare institutions in Singapore, supported by full regulatory approvals. By combining real-time insights, personalized guidance, and operational efficiency, AI2D empowers healthcare providers to deliver safer, smarter care for patients with lower respiratory tract infections.
In the course of my work, I see a lot of patients with diabetic foot problems. Over the years, we have treated many of such patients. The outcome of traditional methods of treatment has oftentimes been very disappointing. We've had too many patients lose their toe, lose their feet, and even lose their limbs. So at Ng Teng Fong General Hospital, we are very proud to be able to bring in this new technique called transverse tibial transport. And so far, we have had a tremendous change in the limb salvage rate of the patients that we treat. For example, I used to do like 2 or 3 amputations a month, and now in the whole of the last 1 year in 2024, we did only 1 amputation. And the proof is in the pudding. Not only are our patients getting better, they're also getting better faster. And we have a whole team of allied health professionals and nurses who support us in our endeavour.
TTT itself doesn't work without a dedicated podiatrists and vascular nurses. It really needs a teamwork from orthopedics, plastics, vascular, podiatrists.
As podiatrists, we see a lot of lower limb conditions. In the current TDT team, we help to deal with the wound care using a negative pressure machine to improve and accelerate wound healing for patients with diabetic foot ulcers that are more complex and harder to heal.
Through my experience, through the trial, I've gained some knowledge and I share it with my orthopedic resource nurses who will guide the nurses in the ward to do the proper dressing.
We have been working very hard at developing treatment guidelines and appropriate use criteria for this TTT. We are developing the technical know-how both internally as well as externally, and we have shared this knowledge with our colleagues in other hospitals within Singapore, including Changi General Hospital, Tan Tock Seng, Woodlands Health, etc. I think it places us in a unique position to be leaders that can drive the development of this new technique. The future ahead does look very exciting, and I think we are very blessed and happy to be at the forefront of all of this development.
Our nurse leaders used to spend nearly 7 hours each week creating rosters. Yet, 1 in 3 staff requests couldn't be granted, and maintaining the right skill mix remained a challenge. To address this, we partnered with our business analytic team to develop Nurse Shift AI, an AI-powered rostering tool that is fast, fair, and designed by nurses for nurses. Since implementation, rostering time has reduced from 6.7 hours to 3.6 each week. Ungrantable requests have dropped from 31% to 19%, and skill mix issues from 89% to under 26%. Nurses now experience greater support, stronger teamwork, and more confidence in staffing. Beyond efficiency, Nurse Shift AI has enhanced morale, collaboration, and care quality. When nurses are supported, patients benefit through safer staffing, better continuity of care, and more engaged teams. We have rolled out Nurse Shift AI across Mount Elizabeth Hospital, Mount Elizabeth Novena, Gleneagles, and Parkway East Hospital in Singapore, and are now piloting it at Gleneagles Hospital, Hong Kong. Our next step is integration with HR and payroll system to automate leave plotting and allowance tracking, creating a seamless end-to-end workforce solution. By listening to the frontline and using data with purpose, we are building tools that strengthen both our operations and the way we care.
In ENT care, patients are often unsure when to return or how to manage their symptoms after their visits. Doctors have little visibility of patient symptoms in between visits. To address this issue, we started Project Antenna, an AI-driven chatbot that collects and analyzes data on patients, scores their symptoms, and tracks their trends over time. Antenna has supported almost 3,000 patients at Ng Teng Fong General Hospital and about 800 patients in Tan Tock Seng Hospital. It is now being rolled out across all 3 healthcare clusters. Antenna has improved patient follow-up rates, helped to reduce unnecessary revisits, and enhanced medication compliance. Patients feel more supported and empowered, benefit from reduced visits and cost savings. Our care team is alerted only when attention is required, saving time while improving quality of care. Antenna is now being implemented across NUHS, NHG Health, and Sing Health. We have plans to integrate AI-powered, avatar-based triage support in Phase 2. We start small, solve real pain points, and co-design with both clinicians and patients. Automation doesn't replace people, it helps us focus where it matters the most.
In innovating healthcare for tomorrow, Changi General Hospital implemented an AI-powered chest X-ray triage system deployed on AIM-SG to automate the prioritization of critical cases for timely reporting and clinical decision-making. Chest X-rays were conventionally triaged in a first-in, first-out basis, which meant that urgent cases may not be identified early. Our AI-powered triage system reduces the average turnaround time for triaging inpatient cases by up to 97% and leads to 50% faster reporting of urgent cases. Diagnostic accuracy remains high, underscoring the reliability of the AI model.
For our radiologists, the AI system reduces workload and helps them focus on prompt diagnosis of critical cases. For patients, this means urgent chest X-rays are identified early so that they receive timely quality care. The AI-powered triage system is being used at Singapore General Hospital and Tan Tock Seng Hospital, as well as at the National Healthcare Group and SingHealth Polyclinics, to triage chest X-rays at those locations. Our advice is to design innovations that integrate seamlessly into existing workflows and to continuously validate their performance in real-world settings. Strong multidisciplinary collaboration between clinicians, data, and IT teams is key to delivering impactful outcomes for both staff and patients.
As healthcare demands continue to grow and evolve, and nursing manpower faces ongoing strain post-pandemic, creating a work environment that promotes flexibility, efficiency, and well-being has become vital. At Tan Tock Seng Hospital, we introduced a liquid nursing workforce, a new way of working that blends flexible scheduling, modular nursing roles, and streamlined handover based on comprehensive time motion studies. Unlike traditional fixed shift, this model uses data-driven workforce redesign to match nurse preferences with actual patient care needs, creating an agile liquid workforce that adapts in real time. The results have been significant. Hospital attrition rates among nurses dropped by 25%. In wards with flexible schedules, 68% of nurses reported minimal burnout compared to the traditional wards. Our revised nursing handover framework ISOBAR reduced handover time from 75 minutes to 15 minutes. Roster planning time was reduced by 83% from 90 minutes to just 15 minutes per workspace, and 34% of ward improved their patient callback response times within the 45 seconds target. For patients, this means faster response time and more focused nursing care with fewer interruptions. For nurses, it means greater work-life balance, autonomy in scheduling, and clearer career growth through modular competency-based roles. We're now expanding the liquid workforce model beyond 55 wards to include pharmacy and allied health departments, with plans to roll it out across all NHG institutions using our smart scheduler technology. The key to success is clear. Start with real data through time motion studies, involve the frontline early, and co-design solutions that balance operation needs with staff autonomy. When innovation is shaped together, everyone benefits: patients, nurses, and the entire system of care.
Traditionally, therapy assistants were limited to supporting roles under therapy supervision. Through our TA workforce transformation, we have expanded their roles.
TAs now are able to manage patients independently, equipped with transdisciplinary skills, and supported by technology. This has strengthened our role as an essential pillar of care delivery. This transformation has empowered us to deliver more direct care, personalized engagement, and improve continuity of therapy for patients. We feel more satisfied with our roles and stronger collaboration within rehab teams.
At ICH, TA-led workload increased from 10% in December 2023 to 20% in December 2024 across physiotherapy, occupational therapy, and speech therapy, which is about 1,500 sessions every month.
This cross-disciplinary upskilling is the key part of workforce transformation strategy for optimizing manpower. Sustaining this transformation requires collaboration amongst allied health professionals, therapy assistants, and leadership. By redesigning the TA role, we have empowered them with expanded job scopes through standardization of competency-based training and workflow to ensure quality care. Looking ahead, our future focus will be on deepening TA's clinical expertise at job grade 9 to 10 and equipping them with new skill sets to support progression to job grade 11 to 12.
Patients undergoing hemodialysis either have fistula, graft, or a catheter as a vascular access. Occlusion of the catheter is common and can lead to serious complications. When this happens, patients were traditionally referred from the community dialysis center to an acute hospital to have the flow restored. It typically requires a 3-day stay in the hospital and can happen a few times a year. This is not only inconvenient but also costly for the patient.
We recognize that these issues could potentially be averted by upskilling nurses in the community. Therefore, Singapore General Hospital, National Kidney Foundation, and National Improvement Unit partner together on the Blast and Clear programs to facilitate early detection and prevention of catheter blockages and train dialysis nurses to safely treat catheter blockages on site.
The timely unblocking of occluded catheters in the community dialysis centers preserves this vital vascular access, ensuring patients benefit from treatment continuity, convenience, reduced costs, and less anxiety.
This means less referrals to acute hospitals, and these beds are then prioritized for more critical needs, creating value for our patients, our families, and healthcare partners. Last counts, by end of September 2025, the data tells us that Clear has already averted 514 admissions from successful restorations of the catheter, saving 1,240 bed days for our community. Also, this has been expanded to all the dialysis centers in Singapore, training 244 dialysis community nurses.